We are a global non-profit organization founded in 2003, and we work on diagnostics, R&D and innovation, combating major diseases affecting the world's poorest populations. The HeadStart project, Hepatitis C elimination through access to diagnostics, is funded by UniAid, and we aim to simplify the HCV testing process and make these tests more affordable. Ultimately, we want to increase the access to these tests for people who need them. In 2018, FIND and Clinical Research Malaysia signed a Memorandum of Understanding allowing us to work closely with the Malaysian government on this project. This also ensures that the evidence generated can help inform national policy as Malaysia strives towards HCV elimination. Apart from the low-income countries included in this project, Malaysia is the only upper middle income country, and this is because of the presence of the strong political will and leadership from Malaysian Ministry of Health and the various partners. In Malaysia, the HeadStart project introduced the use of Quality Assured Rapid Diagnostic Tests (RDTs) in primary healthcare clinics. It's a simple finger prick test with results out in 5 to 20 minutes. Before this, HCV diagnostic services remain largely centralized in Malaysia, and they are only available in hospitals or laboratories. The use of RDTs in primary healthcare clinics can now reduce the overall time and cost needed to know the disease status of a patient, and also allows him or her to be linked to care and management shortly after diagnosis. For patients who test positive for HCV, they will be offered treatment in the following ways. They can join an ongoing DNDi clinical trial, or alternatively, they can enter the National HCV Program, which provides free treatment originally in government hospitals, but now MOH has also rolled out this free HCV treatment in primary healthcare clinics. As a result, the HCV test and treat strategy can now be scaled up as patients can access all the HCV services, including treatment at primary healthcare level settings. This is where people first access health services, and this is very important for at-risk populations such as the marginalized and needy communities. One of the main hurdles is to convince populations at risk to come forward for screening at the primary healthcare clinics. Many of these patients are not aware of the disease nor the complications which arise from late management. Very often, they have not even felt any symptoms. So the civil society organizations played a pivotal role in raising awareness and providing counseling to their communities and directing and facilitating them to come for screening at healthcare clinics. They definitely have enabled us to overcome this very difficult hurdle. I personally feel that the first highlight of the project is we are able to simplify the testing process and reduce the time for the patient to receive the results. As a result, we can then now screen more at-risk populations and link them to care and management. The second highlight is that the valuable experience and evidence from this project has helped MOH to form the basis for them to implement the test and treat strategy at their primary healthcare clinics. This is where patients first access health services, so they don't have to go further to the hospitals anymore. And this can greatly facilitate them being cured of the disease in a shorter time frame. I'm very honored to be given this great opportunity to work with dynamic organizations like MOH and DNDi. We all put patients before profits. The Ministry of Health, from the management level to the healthcare workers on the ground, are all very committed, and they play a very important role in facilitating the implementation of this project. On the other hand, DNDi and FIND are both product development partnership organizations where we develop health solutions to combat the neglected diseases. Our mandates are very well aligned, and this allows us to work coherently towards a common endpoint. This is notably the most remarkable journey in my career, so I'd like to thank you very much to MOH and DNDi.